respected seniors, friends. In these 10 minutes, I have to talk about middle path regime in TB. Is it still relevant? But first, when I asked my juniors, a lot of people don't know what's middle path now because times have changed. And the concept was borrowed by Professor Tully. Middle path is that in order to become to gain spirituality, you don't have to become a sannyasi. You can become a householder and all, still become attain spirituality. So that's from where Professor Tully adopted middle path, because the Hong Kong school was advocating aggressive surgery for anterior tuberculosis. It says anterior disease, do debridement and put bone graft. And Professor Tully said all spinal tuberculosis cases do not need surgery, and all those who do not respond to conservative measures should only be operated. So he says operate only for neurological deficit and those resistant to treatment from tuberculosis. He always maintained these words that tuberculosis is a medical disease, it should be treated with medicines, and most of the time granuloma also heals with bone and it forms bone. So that's what his philosophy was, and almost a lot of treatment you could do with his regime. As for 10 minutes you can't complete this talk, so if you go around Professor Rajshekharan and Dr. Anil Jain, when you meet them, as Lord Shiva told Ganesh to go around the world, in just around Lord Shiva, you will know most about tuberculosis, because these two people have written maximum on tuberculosis in world literature. If anybody has written, these two people have contributed maximum to tuberculosis. So what is middle path regime? It is rest in hard bed and chemotherapy. X-ray and ESR once in 3 months, MRI, CT at 6 months interval, and at 2 years final follow-up. Gradual mobilization is encouraged in the absence of neural deficit with spinal braces. So if there is no neural deficit, gradual mobilization. Otherwise, put them in bed. If there was abscess, Professor Tully advocated drain the abscess, put in streptomycin and INH in return, and then the abscess would heal by 6 to 12 weeks. Neural complications, if occurs early neural deficit, even then you can continue to treat with anti-tubercular treatment, because if it's healing and if the neurological deficit is resolving, you can still continue it. And Professor Jain, in one of his papers, has written even up to 70% of canal compromise is compatible only in tuberculosis of spine, unless there is a vascular component. Excisional surgery or surgery was only for posterior spinal disease or patients who did not respond to conservative treatment. So this was the drugs, but I think I will omit this slide because of lack of time. But he started with only rifampicin or ofloxacin and added parazenamide in the continuation phase. But now this index TB guidelines very clearly says you give 4 drugs for 2 months and then 3 drugs for depending on